Healthcare providers are trained to treat people who are sick, but sometimes they can find themselves in a dangerous situation. In many cases, healthcare workers are assaulted by the very same people they're trying to help. Our Carlos Correa is live this morning as hospital leaders work to keep their facility safe. Carlos?
Sonia, you may remember a security officer died here at Cox North last summer after being attacked by a patient. Well, now with the proper training and the proper moves, many area hospital workers are being trained to survive potentially deadly threats. As they help save lives, area healthcare workers are learning just how to save their own.
These situations occur because, remember, in the emergency room, a lot of times they're dealing with the same people that a police officer may come in contact with. So it's not always, and not everybody's out to hurt the healthcare provider. And sometimes the healthcare provider is so willing to help everyone else that they will sometimes move themselves into a situation not being aware of the potential of danger that may occur.
Workers at Skaggs Regional Medical Center are taking part in a training to learn about defensive tactics to protect themselves from violent patients.
There have been places or agencies that have had EMS providers, nurses, physicians, or whatever fired because they themselves have assaulted a patient. Because remember, without training, people revert back to what we call caveman tactics. They're scared. They may lash out, strike somebody, or and not knowing, just because it's a defensive mechanism.
The Bureau of Labor Statistics say a healthcare provider is more likely than a police officer or even a prison guard to be assaulted on the job. And that's something hospital security wants to change with new procedures to keep people safe.
Anytime we have an event that is of magnitude that impacts the emergency room or the facility itself, we try and set up our incident command center and run it through the incident command system.
Healthcare workers aren't just learning about escaping from a fight, they are also learning how to properly document an incident, which can help prosecute a suspect later.
This training that we take not only gives them the ability to defend and to keep themselves safe, their fellow employees and the patients, but it gives them a more of a confidence level that they normally wouldn't have.
Disaster drills are planned at many area hospitals over at Skaggs. They participate in one twice a year. Now on April 11th, the hospital will be teaming up with the new Branson Airport to participate in a plane down scenario drill. And in the meantime, you can head over to our website, ozarksfirst.com. We'll provide more information on that training happening next month for EMT providers.
Carlos Correa reporting live. Thanks, Carlos.